Well, with the outbreak of deadly coronavirus or the COVID-19 already spreading enough fear, fake news of a positive suspect for the virus was reported in Rajiv Gandhi Institute of Health Sciences. But doctors have now confirmed that it was a fake news and the patient has been tested negative. The patient hails from Bengaluru and had returned from Hong Kong. So now several such reports doing the rounds of fake positives and stating that they have been tested positive for coronavirus or COVID-19. So clearly now the Rajiv Gandhi Institute of Health Sciences, they have confirmed, they had sent a report to Pune to test for the entire virus. Now seems like it has come out negative. Well, my colleague Prajwal Prasad has interacted with the director of the Rajiv Gandhi Institute of Health Sciences, that is Nagraj, to get us more information on such rumors doing the rounds and in particular this case as well. Let's listen it.
We are here at the Rajiv Gandhi Institute of Chest Diseases, and it had also gone ahead and created a lot of panic, stating that one of the men who was picked up at the Kempegowda International Airport had possibly tested positive for COVID-19. I'm here with Director Nagraj himself. Let's go across and speak to him. So first and foremost, now they picked off a person from the Kempegowda International Airport on Saturday, and it was stated that there were symptoms of COVID-19. What do you have to say?
No, patient had come on the Saturday itself in the evening around. We admitted him around 8 o'clock. The patient, of course, he had symptoms of a fever and then cough. And we took an X-ray. Of course, there was some amount of X-ray patches there. And then we started the supportive treatment, like antibiotics also, as well as oseltamivir, like other drugs. Then we sent the patient, we sent throat swabs, and just now we got the report. It came as negative. There is a huge relief for us also, as far as so many people also used to ask. And since morning, so many people are inquiring about that. And that day itself, Saturday, somebody called me up and then one positive patient is coming to your hospital. Then I said, no, it's not like that. We'll take a swab and let me know afterwards. And I hereby to convey the message to people not to be panicky. Till now, not even a single positive case has been reported. Since till yesterday, we tested about 117 patients. Out of that, 109 are negative. That means they all are negative. That means the people should not be panicking. Thank you.
Sir, one more important thing, sir. When they speak about quarantine, they say that quarantine is a procedure. People are also panicking, stating that how does quarantine work out? What will happen during the quarantine process? So if you could just help our viewers understand as to how this entire procedure goes about.
See, again, quarantine is different from home isolation. When, of course, the government authorities, when they send the patient from airport, suppose the patient is symptomatic, if they are from Wuhan city and other endemic cities, if they are symptomatic, we will have to isolate the patient. If the patients who from Wuhan city, whether symptomatic or asymptomatic, we have to isolate. But if they are not the symptom, if the other countries, and after the reports come as negative, immediately, because earlier used to take about 2 to 3 days to get the reports. Now it is not so. Because in Bengaluru itself, 2 more labs are added. So one is in our campus only, NIV our campus, one is in Victoria Hospital. So with this addition of 2 labs, we could get the reports within 24 hours. So similarly, this patient is admitted on Saturday evening. So today we got the report, it just come as negative. So isolation means home isolation. Because there everybody used to ask some questions, sir, visit contain. No. We have to contain one patient in a single room with a good ventilator area, and visitors should not be allowed, including the spouse and then children. To have to say that a patient has to use his own utensils and then belongings, and then he has to frequently wash his hands, and he has to follow cough etiquette. So that means when he is coughing or sneezing, he have to keep some barrier, say for example tissue paper or any other cloth, if not right elbow. But the thing is, you should not use the kerchiefs. That has to be avoided, because kerchief frequently is no. That's why kerchief has to be avoided. And then he has to take plenty of liquids and good nutrition diet. And importantly, you should not mix up the crowded people. Only thing is that 28 days, now whatever we said, 28 days of isolation, but we have to counsel him. Because what you have to tell, because it has to be contained yourself and it's not spread to your people.
No false news, no panic. Do not need to worry. You can go ahead and also confirm with the authorities, because panicking will only go ahead and make the situation worse. With camera person Baswaraj, Prajwal Prasad reporting for News 9, Bengaluru.